Hello, you are listening to the Charles Bonnet Syndrome podcast. This is episode 6. My name is Shaman Foy, and I'm here with my co host, Eva Potts. And today we are interviewing Dr. Gary Cusick. He is the leading expert in education, research, and support for Charles Bonnet Syndrome in the United States. How's everyone doing today?
Good.
Doing well, thank you, Shimon.
Yeah, I'm so glad we were finally able to get you on this podcast. We were really looking forward to it, Dr. Cusick. So you're the expert, as I said. I'll share a little bit of a story, and Eva probably has a similar story. I have a family member who has Charles Bonnet syndrome, and I didn't know what it was at first, like most people, probably all people. And then when I did a little bit of research, I found out about Charles Bonnet syndrome, and I Googled it. And when I Googled it, I actually came up on a website for Esme's Umbrella, which is a British organization, and it's founded by Judith Potts. And on there, she has contact information. And then it says down when you scroll to the bottom, it says for the US, it says contact Dr. Gary Cusick. So I reached out to him, and he spoke to me for a good while, and told me about some support groups that he has and some things that he's done, and gave me some information. I'm forever grateful for that. So that's just a little bit about how I found Dr. Cusick, and many other people have a similar story. So first of all, thank you for what you do.
Oh, absolutely.
Yeah. And I guess we can go back a little while because I know you've worked with the blind and the visually impaired for some time now. So if you can take us back some years and tell us how you got involved with that community and how you started helping them in the beginning.
Okay. My PhD is in rehabilitation psychology from the University of Wisconsin-Madison, and I'm a licensed clinical psychologist in Louisville, Kentucky. Uh, I worked for 18 years at the Charles W. McDowell Center, which is a state rehab center that's in Louisville. Nobody ever teaches a psychologist how to work with folks who are blind, so everybody's self-taught. While I was there, I administered intelligence, memory, personality, neuropsych assessments to folks with a variety of conditions. I probably have as good an understanding as people with visual impairments as is possible for a sighted person. And about 1 in 3 of the folks that I work with there had Charles Bonnet Syndrome. Hardly any of them would bring it up in interviews, but if they trusted me and I asked them directly, they would tell me that. Probably one of the most fun things about this is to tell people that they're not crazy.
How did you find out about Charles Bonnet syndrome?
Oh, I'd heard about it here and there from my blind coworkers at McDowell, and they just would talk about it. They didn't say much about it. They didn't seem to give it any importance at all. Uh, and then one day, this young woman comes in and she tells me that she's seeing faces that are disfigured and, dark spider webs and such in the corners of the room. And she was really upset by it. And I just did not know what to do with her, did not know what to do for her. So I started looking. And so that's pretty much how I got into CBS. After that, I started talking to everybody about Charles Bonnet syndrome. A person that cuts my hair, the person that cleans my teeth, anybody that's willing to listen.
Wow, so your research led you to it when most other people didn't even know it existed.
Yeah.
And well, around how long ago what was that when you first found out about the condition?
I don't. I'd like to say I've known about it for the whole 18 years I was there, but that's not true. So I guess I've known about it for about 8 years, I guess, and have been acting on it for about 8 years. I have what's called a clipping service from Google that they email me the links to the most recent research on Charles Bonnet, and I've found about 300 articles in the medical literature, most of which are single subject case studies. The audience for this is ophthalmologists, neuro ophthalmologists, optometrists, and psychiatrists mostly. There really isn't any journal articles aimed at persons with Charles Bonnet or their caregivers.
Okay, and one thing I think it's probably important to mention that you're not a medical doctor, you're a PhD.
Right.
You always tell us that. So I just wanted to tell the audience that.
Right.
So how did you meet Judith Potts? Because you're actually on listed on her website, and that helps get some traffic your way to get some people some help. So how'd you meet her?
Well, looking for information on Charles Bonnet, the most coherent thing I found was Esme's umbrella, and so I sent an email to Judith, and to talk to her, and we had a nice chat. Maybe a year later, my wife and I were in London, and we actually got to meet her at her club, which was about the most British thing I can think of to do in England. Uh, yeah, an amazing woman. So much energy and so much dedication to this.
Wow, that's great. She is very helpful, and I've reached out to her, and she responds to anybody, and she really has a heart and puts a lot into furthering the cause and helping everyone. So I know that you have a support group. How long have you had that support group? Can you talk about it for a little while?
I think we're going on about 4 years now. Um, I was talking with someone on. Someone had called me about Charles Bonnet. We were talking, and we decided that jointly that there should be some sort of support group. And at that point, I started having a Zoom group, and the group slowly grew. Uh, and I think I may have talked to at least 100 people since then about Charles Bonnet. The support group is Saturdays at noon Eastern time, with the first hour being for everyone, families and people with Charles Bonnet, as and their caregivers, and then the second hour is just for caregivers to give them an opportunity to sort of network with each other and talk about some best practices.
Okay. All right. Now, one thing I think is important to say is what Charles Bonnet is. We've said that in the first episode and reference it obviously in all the episodes, but I'll say it again. So, Charles Bonnet is when someone is blind or has a visual impairment, and as a result of that, their brain fires up images or hallucinations, and these are silent hallucinations. And this usually when someone is relaxed or sleepy. Not always. It's different for different people, and it's a medical condition. It's not a mental condition like dementia or Parkinson's or schizophrenia. And Gary, feel free if you want to add anything to that or elaborate on that. But I just wanted to say that because someone may be picking up from this episode and they may not really necessarily know what Charles Bonnet is, and they're just introduced to this
Sure,
podcast. Is there anything would you like to add to that or tell the people about what Charles Bonnet is?
sure. Typically, we know the world from our senses. That's sort of a bottom up process where our senses tells our brain what's going on out there and what's happening. In this situation, it's a top down thing. Input from vision has slowed or been deteriorating or totally stopped. And as a result, the brain gets excited, as you were saying earlier, and starts to produce uh, visual manifestations on its own. So they're hallucinations, and all a hallucination is a person's perceiving something that's not coming from their senses. That's the simplest way to describe a hallucination. So one of those things would be phantom limb pain, where you have an amputated limb and it feels like it's still present. Usually it's itching or painful. Myself, I have tinnitus or ringing in the ears. Now that's a hallucination as well, because if you put your head right up next to mine, you wouldn't hear any ringing. It's a hallucination of sound where there isn't any, because I've lost part of my hearing spectrum. Now, persons who've lost sight, the visual hallucinations appear even though their eyes aren't receiving images of the world. Now, that can happen with reduced vision, limited vision, loss of vision in just one eye, all the way to no light perception. One of the best ways to know that what you're looking at is a hallucination is think about your remaining vision, and chances are that's not very good in terms of visual field or in terms of clarity. But every time you see a Charles Bonnet hallucination, it will be crystal clear because it's not coming from your eyes, it's coming from your brain.
Wow. And I've heard some people say in the support group that that has helped them, and they'll say, "Hey, this is crystal clear, so I know it's Charles Bonnet."
Hmm.
So that's what are some tips you can give? That's one to me. That's a tip. If you just allow someone, just remind them of that, then that could be something that they can draw on. But what are some tips that you can give people with Charles Bonnet to help manage their condition or deal with it?
Okay. My journey in Charles Bonnet syndrome has been all over the place. I've looked at, philosophy and epistemology and biology. It covers a lot of things. What's real, what's not real, what's a memory, and what's something that's going on right now. Uh, your brain is a meaning making organ and it tries to make sense out of everything. So when you look up at clouds, you see bunnies and horses and stuff, even though they're not there. That's very typical. Uh, in Charles Bonnet, you're going to be looking at something and trying to decide why is there a person sitting on your couch that you don't know, for instance, or several people. Um, they're random and they change very quickly. They come from just your visual memory, as I said. They might reflect circumstances in the person's real life, like fear, pain, anxiety. They have a first person point of view, and the person with CBS may be involved or only a spectator. Um, a lot of folks with Charles Bonnet ascribe some sort of agenda to the people that they see or objects that they see. They can evoke emotions, and familiar scenes and locations are typical, as are images of people you already know.
Dr. Cusick, would you say that memory plays a very significant role in the types of hallucinations and experiences that people with Charles Bonnet have?
Oh yes, the brain is supposedly has as many neurons as there are stars in the universe. I'm not sure how they figured that one out, but it's your memory is really very deep in terms of visual memory. So you'll see think memories of old houses, schools, cities you used to live in that you don't live in anymore. Some people actually wake up in the morning and they think they're someone else. They have a hallucination that I guess I've called 360-degree hallucination, where everything all the way around them was a hallucination, as opposed to being just a discrete thing in their visual field.
My mother experienced that. Are you referring to when we've talked in support group? A few members have experienced they awaken and they feel that they're not in their home, but it looks just like their home. And their husband or their caretaker is there, and it sounds like them. If they have a field of vision, it looks like them, but they don't believe it's them. And that's a very that's a phenomenon of the Charles Bonnet. Would you agree?
Yeah, I think having trouble identifying a family member or caregiver is that's really there is different than Charles Bonnet. The boundary of Charles Bonnet can be kind of hard to determine sometimes. Uh, it seems very much like dreams, in that the boundary can be kind of vague. Uh, there's no sound when you have a Charles Bonnet hallucination. The person may be moving their mouths, but you're not hearing anything. And we've had a few folks say that they seem to be hearing someone talking, whereas I think maybe what may be really happening is their brain has decided what the person is saying, and it's come into their mind as if it really was, as if it really happened. Sometimes white noise can give people a sensation that they're hearing music or voices. And if you think about the demographic that's typical for Charles Bonnet, older folks typically are more likely to have a visual impairment as well as a hearing impairment. So that may not be all that unusual.
I think I'm referring to also my mother had the experience where she felt that we had replicated. She was in her home, but felt that it was a replicated rendition of her home, and it was very difficult to explain to her. I could walk her around, show her objects that were hers, and she would say, "Yeah, you duplicated that." And it was very difficult. And then one day she awakened and she was back to she was back into her home. But I've heard that from many people in our support group, not many, several. And that has got to be so unnerving. I know it's unnerving as a caretaker, but for the person that's experiencing it, that seems almost scary, almost movie like.
Yeah, it can be very Twilight Zone. A couple of the ways we've suggested that people get regrounded in where they really are would be if they have a pet, call a pet to them, and if the pet comes, they're home. They're not. They're the pet doesn't exist in the hallucination, which is not to say you can't hallucinate your pet. Or otherwise, objects. You can feel the headboard if you're in bed. Some objects that may be particular to you, your glasses, or where your nightstand is and what's on your nightstand. Those are things that'll tell you that even though you can't see those or you see something in their place, that you really are where you are because you're not going to hallucinate anything you can touch.
We didn't find you until after mom had experienced that type of hallucination. And when we found you, I think she was able to explain that to you. And I'm so grateful that we found you. That was a very difficult period. And the unfortunate part is it just seems to exacerbate everyone else's belief that that person has dementia or they've gone into a mental illness, and you don't snap out of it and regain your sense of self. If it's a mental illness, it's or if it's dementia, you can't remember what you forgot when you have dementia. And it's such a relief that you're here in the United States, that you're helping people cope with this. And the reason I wanted to bring that up is that a lot of people may be experiencing this with their loved one and have no clue that this is Charles Bonnet syndrome. And we're finding that there are so many levels and uh, almost a spectrum of hallucinations for
Very good.
Charles Bonnet syndrome. Pardon?
Exactly, exactly.
Yeah.
I'm reading a book on hallucinations right now, and they over and over again, the authors of the book will say that hallucination is a spectrum. People who are fully sighted, have all their senses working just fine, can have hallucinations. Probably some of the caregivers have had hallucinations before. One of the downsides of not knowing enough about Charles Bonnet and medical practitioners is they tend to take that one symptom and really run with it. So they think, well, what else has a symptom of hallucinations? Well, there's dementia, and there's a couple types of dementia that have hallucinations. Lewy body dementia, Parkinson's disease can also have a visual issue. As you get closer towards the end, you may also be experiencing some hallucinations with just Alzheimer's type hallucinations.
Right. And that actually did happen with my mother. And I'm very grateful you took several hours to explain to my mother what she was experiencing. It was so frightening for her. And I think you would agree that it's so important. And every time I get on a podcast, and I'm like you, if something will stand still long enough, we're going to talk about Charles Bonnet. Uh, a person, a dog, I'll talk to anybody about Charles Bonnet syndrome because it's so important for the medical community to know, for the general public to know. And I implore every time that we get on the podcast for people to listen, because people are going to their primary care physicians or their ophthalmologist, and the symptoms are being ignored. They're not paid attention to. And it's so frustrating, as we know from our support group members. They go to the doctor and they don't get a proper diagnosis. And they're throwing their hands up in the air. Now, what do I do? Where do I go to next? And that's a very frustrating roadblock for these individuals. Wouldn't you agree?
Absolutely. People have a tendency to put more faith in doctors than they do in their loved ones sometimes. And if the doctor says they're demented, then they're demented. Whereas I kind of think of that as a lazy diagnosis. Now, if a person has dementia, they should be having some problems with memory of various types. And folks with Charles Bonnet, often they don't ask about memories, they're just talking about the hallucinations and overlooking that. In terms of hallucinations that may come with schizophrenia, first off, most schizophrenia hallucinations are auditory, not visual. And persons with schizophrenia have a number of signs that they have schizophrenia, not just that single symptom. They'll start to their hygiene will go down. They'll lose interest in things. They may stop talking. They may not be moving very much. So there's very clear ways to do that. Getting back to memory, the Montreal Cognitive Assessment is like a 5-minute bedside assessment that doctors of any kind could use that would pretty much tell you whether or not the person has some sort of cognitive problem or not. And I would expect the people that I've worked with that I know have Charles Bonnet syndrome would come through it with flying colors.
And we would also encourage, and I think you would agree with me, Dr. Cusick, that if you're a loved one and or a caretaker of someone with Charles Bonnet syndrome, the first thing to do is believe them. They're opening up to you. They're trusting you. They're asking you for help when they come to you and they tell you, I know I'm not crazy. I don't think I am. Of course, they're starting to believe they are because of the hallucinations. As a caretaker and a loved one, believe them and then get them to a doctor. And if that doctor won't properly acknowledge Charles Bonnet, then ask for assessments. Ask for them to go through the assessments of what you think it may be so that they can be eliminated. And go to our Facebook page or Dr. Cusick's page or Esme's Umbrella, wherever you have to go and request or download the information that you can take to a physician that explains what Charles Bonnet is, and get that person properly diagnosed. If possible, it does have a billable code and it does exist out there. So that's not an excuse any longer. But wouldn't you agree, Dr. Cusick, that the first thing to do is believe the person?
Yes, many folks that we've talked to tell us about going to the doctor, and the doctor either ignores it. They they say, "Well, just go ahead and enjoy it." They say, things that take away the validity of their experience. These folks are experiencing something that's very anxiety provoking, or can be, and they're just being, disavowed of that. Isolation like that and loneliness can also cause hallucinations in people who are fully sighted. So, if you're already seeing things as a result of Charles Bonnet syndrome, it may kick things up a little bit.
And there's that grief factor as well. When someone is losing their vision, or the person that you love or are caring for are changing because their vision is declining, either gradually, sometimes drastically. My mother's progression was drastic at a point. Of course, it was a gradual process of her losing her vision, but when it was gone, that was like a freight train, glaucoma. And if you have somebody with glaucoma in your family, please have your eyes checked. And if they start hallucinating, this is definitely consider the Charles Bonnet. But yes, in our support group, we have so many people who struggle with their loved ones and caretakers understanding them. And then we have some that just have the most amazing caretakers. We're here for the caretakers as well, and understand that grief is something that the person who's losing vision or the person that is caring for them, I think both people are experiencing grief. And wouldn't you agree, Dr. Cusick, that understanding that the loss of anything significant, and vision being one of them, it's really important to recognize that and give that validity as well.
Your independence goes away when you lose your vision. You can't drive anymore. You maybe can't walk around the block anymore. So you're bound to be grieving that loss. Uh, One of the things that everyone should remember about Charles Bonnet is that 100% of the people that have Charles Bonnet have a visual impairment. And most, well, I don't know about most, but many people don't even understand blindness. They'll look at a person and their eyes look okay, they're not filmed over or something like that, and they'll say, "You're not blind." That doesn't have anything to do with it, what your eyes look like. Uh, so they'll do stupid things they'll move things around, they'll move the furniture around, throw things at them to prove that they're actually not blind. It can be really crazy, cut you out of the conversation. Christmas is coming up and they'll not include you in what's going on around them at a family gathering. Also, people that we find with Charles Bonnet oftentimes have not taken advantage of the services that are available to them. Every state has a service for folks who are blind. The group that I worked with worked with people who were working age 18 to 64, but there's another arm of the group that works with people who are elderly living in the community to help them more uh, be independent without things. They'll mark appliances and they'll do cane travel training. Canes are really important for folks with blindness and would also help with Charles Bonnet syndrome. And some of the things that can sort of replace what they've lost. There's television programs that are audio. They have an audio feature that tells you what's happening when the characters aren't talking. There's free book service for folks with visual impairments. There's blind radio. So there's a lot of different ways that folks who have visual impairments can also regain those skills. But it can be a steep climb.
What's a good way for people to find out information? Should they just type in, let's say if they live in Kentucky, type in Kentucky, um, I don't know, Foundation for the Blind or something, or Commission for the Blind, or what's a good way for people to find resources?
Oh, great question. My agency in the 18 years that I worked for changed their name 3 times. So usually there's a blind or visually impaired words in there, and that would typically do that. Those are state federally funded programs. There are also consumer groups, uh, the American Council for the Blind and the National Federation for the Blind are consumer groups that are aggressive in terms of helping folks with visual impairments. There are other groups that are sort of semi-professional, like the Lions Club and the Foundation for Fighting Blindness, which work to help people uh, regain their independence following blindness. And blindness is a really funny term, also. When I told folks I work for the Office for the Blind, they thought that everybody I work with was experiencing no light perception. They couldn't see a darn thing. And that was very unusual, actually, of the folks I worked with. There were a percentage that had no light perception, but most could see something. Their visual field might be reduced, it may be blurry, they may have trouble with bright lights or dim situations, but they're not what most people think of as blind.
On that note, Dr. Cusick, so that the audience can understand that Shimon and I did not make this up, or that we discovered, or that we were giving false information. Anyone who has low vision or um, has no light perception, visual impairment of any type, can experience Charles Bonnet at any age, any ethnic background, and any gender. It is indiscriminate. Would you agree?
Absolutely. I've worked with I worked with adults, but they would tell me that their Charles Bonnet started when they were children. One young lady had been put on antipsychotics, at, as a child, and stayed on antipsychotics all the way till the end of high school when she was able to tell people, "I don't want to take these anymore." Uh,
And all the damage that does to the brain unnecessarily.
well, with older folks, antipsychotics are you're more likely to have a fall with
Mhm.
antipsychotics because they're very tranquilizing. And as you said earlier, I'm not a medical doctor, and I won't talk anybody that I work with out of their doctor's recommendations. I'll give them
Correct.
information about what their doctor's doing because information about the drug they're taking is very sparse a lot of times for folks that are visually impaired. You might get that little sheet that comes with your prescription, but they can't read it because they're blind. So I do a lot of patient education for that.
And on that note, we should remind anyone who's listening to this podcast, and if you feel that you've determined that Charles Bonnet is what you might be dealing with, or your loved one, or someone you're caring for, don't discontinue medications without visiting the doctor.
Exactly.
That's We are
Exactly.
not here to discourage or imply that you should stop your medications. Always speak with your medical professional, but ask questions, advocate
Be a good
with
patient.
Charles. Correct. You're going to be advocating for your loved one or for yourself, um, or the person you can take care of. Shimon?
Yes, that's so true. And also, as we mentioned in previous episodes, there are many things that can cause hallucinations, from medicines that are legal to illegal substances to conditions like Parkinson's and dementia. So definitely work with your doctor to rule all of that out. But like Gary said, Dr. Cusick mentioned that you have to have a visual impairment to have Charles Bonnet. That's one thing that I would like to see change. I would like to have more ophthalmologists and optometrists provide their patients with literature, especially if they have an eye disease or some kind of a serious condition, and just let them know that it is a possibility. It's on the smaller end, we think maybe 30 to 40%, but it still can affect you. Just so if something like this starts happening, they don't panic. And then I said, well, what about people that are hypochondriacs or something? What would you do then? But I think with everything there's a risk, and there's a chance. You have to try something, and I think having more information than not enough can be helpful. So hopefully we can do that with your organization, Eva, and people like Dr. Cusick helping us spread the word.
Yeah, this is not like it's something that just was diagnosed yesterday. Charles Bonnet was a naturalist back in the 1700s, 1780s, and he identified it in his grandfather. So that was the first ever article. Many, many years later, they decided to name this syndrome after Charles Bonnet, after he was dead and gone. Uh,
1967.
1967. Oh, thank you. That would be many years.
That's a long stretch of time between the 1700s. It's a long time. It's in the words of someone I was speaking to about this, my massage therapist. She said, "We need to wake up. We need to wake up about Charles Bonnet syndrome." It blew her mind. She'd never heard of it. And you hear that a lot, don't you, Dr. Cusick?
Oh yeah, I recently found a book called A Thousand Colored Castles, which is like a graphic novel that has Charles Bonnet syndrome as a subject, and it doesn't hit you over the head with it. It kind of eases you into this woman's experience with Charles Bonnet uh, in a very subtle way. My wife, who's been listening to me go on and on about Charles Bonnet for years, was really surprised by what she learned from this book. I think it would be very good for family members to have. It's available for sale, and I get no kickback from that, by the way.
It's always great to know that there's something out there to help individuals learn more about it. And, there are articles online. Unfortunately, many of them are written in medical ease that is a little difficult to understand. So if you're listening to this podcast and you feel that you have a loved one or someone you're caring for, or you yourself are experiencing Charles Bonnet syndrome, go on charlesbonnet.com, go to CBS Awareness on Facebook, find us. Our numbers are there, and we are happy to talk to you. You're always going to be referred to Dr. Cusick, and at least find out where you are with the situation, and Dr. Cusick will tell you what your next step should be. Am I correct in that, Dr. Cusick?
Yes, thank you. Yeah, I've talked to. I have calls from um, all over the United States primarily, but I've had even one call that started in the United States and ended in India, where this fellow from India, New York, wanted to talk to me about Charles Bonnet and his mother who lived in India. So it's it should be better known than it is. Um, Also, this I've taken this on as a mission for myself. I don't charge for any of this. Quite a few people ask me, how do we pay you for this? And the answer is, you don't pay me for this. This is just
I asked
something
you
that
that question.
yeah, I think it's just that important. Oliver Sacks wrote a book on hallucinations, which I would recommend to everybody. And the very first chapter was called Charles Bonnet Syndrome, The Silent Multitude. Now, what he's told you there is a lot of people have this, not just a couple. If you say 2% of the U.S. population has a visual impairment, and 40% of those have Charles Bonnet, that's a couple million people in the United States, just in the United States.
And the
Um,
research that they're conducting in the UK, if I'm correct, Dr. Cusick, and if I'm not, please correct me, Dominic Fitch and his research, they've established in the UK that 1 out of every 3 individuals with low vision or no light perception is experiencing Charles Bonnet. So that number in the US has got to be staggering.
that was my experience. Was about 1 in 3 of the people that I asked would say they had it. I know for a fact that some of the people that told me they didn't have it really did. It can be very fear inducing. You've lost your vision, so now you've lost that much independence, that much of your ability to make choices for yourself. And then if you start seeing things, then that's just one more step down the slippery slope towards becoming institutionalized. So I totally understand why people would be reluctant to tell someone that they're seeing things, but it's about blindness and visual impairment. If you don't have blindness or visual impairment, you don't have Charles Bonnet syndrome.
Correct. And I want to revisit something you said that is so important about the individual from India. This isn't just happening in the US, folks. This is happening globally. This is, and the sad thing is, or the sad information or lack of, the only countries that we understand are even trying to do anything about this, as far as we know, are the UK, Australia. We got one Lone Ranger in Canada, and the team of people here that you're listening to starting a nonprofit to address Charles Bonnet syndrome. And and it's important to know that this is a global problem.
Yeah, one of the things that is so frustrating about Charles Bonnet syndrome is that plenty of doctors, plenty of good medical doctors, don't even know what the condition is. So I have a loved one, and they have Charles Bonnet, and when they're ready to share their story, I'll mention who they are. But they have Charles Bonnet, so I went to the doctor with them after I found out about Charles Bonnet, and I just mentioned it to the doctor without their permission. They didn't like the fact that I did that, and the doctor said, you need a first of all, the doctor said they weren't familiar with Charles Bonnet and they never heard of Charles Bonnet syndrome. But then after that, they said you need a neuro ophthalmologist. So I said, okay, this is great. They've identified the doctor that can help my loved one. We're going to get them to this doctor. So my loved one made the appointment, and I went with them, escorted them there, spoke to the doctor. The doctor said, yes, this sounds like Charles Bonnet, but there's nothing I can do to make the hallucinations go away. and then basically the visit was pretty much over, and it was very discouraging. And they were saying, "Wow, this has been discovered for over 200 years, even longer, and most people don't know about it." And then they go to a specialist who's supposed to specialize in the mind and the eyes, and they can't even do anything about it. So it can be very discouraging when you have situations like that. What I hear you say a lot of times, Dr. Cusick, is that you believe that one of the ways that people are going to have to cope with this is talk therapy. I've also heard cognitive behavioral therapy. I've also heard hypnosis, like natural things and a mindset shift. But I don't know if you want to speak to any of the things that I just said.
Sure. Cognitive behavioral therapy is actually in the medical literature as a treatment for Charles Bonnet syndrome. It's the most research supported method for counseling that there is. So it would definitely uh, really good. Um, there is no cure for Charles Bonnet syndrome, but you can live with it much more comfortably. Some of the folks we've been working with for a couple of years have reduced the number of hallucinations that they see each week and reduced the amount of disruption in their lives that they cause. So, one of the things you can do for Charles Bonnet is, aside from just going to a professional, which is definitely important, would be just to change the balance of power between you and your hallucinations. Take an active role in coping with it. Learn all you can about how people with vision loss develop Charles Bonnet. Don't allow yourself to take a victim role, feeling powerless to deal with the images. And any power that the images have, or people or whatever have, is power you give them. Seek family, friends, and caregiver support groups who take an interest in your experience rather than just dismissing it to mental illness or dementia. You should take back your quality of life and relationships from before Charles Bonnet syndrome. And of course, as I said earlier, get services that'll help you cope with vision loss.
Thank you for saying all of that. One thing I think about is that you said this too, Dr. Cusick, that our whole lives, what we see is kind of seeing is believing. That's how things work. You see it, you look out for things and it's real. But then when you get a visual impairment and then you develop Charles Bonnet, seeing is not necessarily believing because what you see may not be real. And if you've lived 30, 40, 50, 70 years one way, to be able to change when you get old is hard dealing with anything, but especially when you have something like this. So, yeah, it's
Absolutely.
definitely,
The
yeah.
hallucinations are really amazing. Really amazing. You could, if there was a hallucinatory person in your front room, you could walk all the way around them. If you tried to touch them, your hand would go right through them. And when your hand went through them, chances are they would disappear. That's one of the ways to cope with them. But they can also appear to move objects in your environment that are really there. One
Mhm.
of our folks says that this couple comes into her room and they, rearrange everything. They put pictures on different walls and rearrange where the clock is and, where the gewgaws are and all that sort of thing. And she sees them do that. But later, after that hallucinatory couple is gone, everything's back to normal. So nothing's being moved, nothing's being changed. It's just part of the hallucination. So these hallucinations, they walk, they talk, they probably eat. If you put food out for them, of course, it's just going to go bad.
Mhm.
They're not. They're not able to interact with the real world. They're not the real world. They're something that very much looks like the real world, but they are not.
And wouldn't you agree, Dr. Cusick, and I've heard you give this advice, and I think it's wonderful advice for someone that's experiencing these hallucinations. Try not to engage with them or become friends with them because you don't want to give them validity and you don't want to give them life per se.
Yeah. Yes. If you, it's a slippery slope down the rabbit hole. If you start to think that they're real, you'll start coming up with a narrative about where they came from, what they're doing, what their purpose in your house is, and it just goes on from there. So if you go to talk to a psychiatrist about this, you say, well, I'm seeing people that aren't there. Okay, there's a hallucination. That's the first symptom of psychosis. And then the doctor says, well, how did they get in there? And now you have this story about how they got in there and what they're doing and all these other things, which sounds very much like a delusion. So now you've met the other symptom that's necessary to cross the threshold into psychosis. So as a result of just those few things, you people get wound up being put on antipsychotics.
Yep.
The hallucinations can be fear-inducing, um, and they get worse um, if you're scared, tired, in pain, haven't had much sleep, if you're sick, if you're lonely. All of those things can make your Charles Bonnet Charles Bonnet hallucinations much worse.
Yeah, and being isolated, and that includes when you say that lazy diagnosis is given, which is just breaks my heart. And that did happen to my mother. A lazy diagnosis. She didn't have dementia. And, many families think that there's no other option than to put their loved one into either a psychiatric ward or an assisted living facility. And there should never be shame behind if your loved one needs to be in that type of environment, then of course, but give this every opportunity to be explained or looked at, because it is something that can be integrated and incorporated into the person's life with the patients. And you know the ability to be patient enough for that person to get where they can understand that the hallucinations are not real. It's very difficult for them at first. Some people, as we've learned in our support group, know that they are coping with something that is going to be different, and they can adjust, and many of our members cannot. And I think, Dr. Cusick, you would agree that it's based on personality type. Sometimes it's based on age, the fear of losing the vision, like you said. There's a lot of fear there, and if you're a fear-based individual, those hallucinations will be exacerbated.
Right. And in terms of, we were talking about the continuum of hallucinations a little bit earlier. We're all social creatures. We need other stimulation. There was a study in 1912 of prison psychosis where they found that prisoners who were fully sighted in solitary confinement had, quote, symptoms which included perceptual distortions and illusions, visual fantasies, often accompanied by striking visual hallucinations in multiple spheres, derealization experiences, and hyper responsivity to external stimuli. So that's a little medical ease for you there, but just isolation, loneliness can cause hallucinations by itself in a person who's a community living elderly person. One of the presenters for our group was a doctoral student in psychology who studied that very population, not people with Charles Bonnet per se, but people who are cut off from not their vision, but cut off from their society. And in that cases, they would be having hallucinations of various types.
So if you could speak to someone that has Charles Bonnet, first I'll say this again. I've said this in the past. I was on a Zoom call with Dr. Dominic Fitch. It was a group of people. It was not just me and him. And he said 1/3 of people with Charles Bonnet have it and they enjoy it. They enjoy the hallucinations they see, or they're mild, and it's okay. And he said another third actually don't necessarily like it, but they're able to cope once they realize that the hallucinations are fake and it's Charles Bonnet, they're okay. And then he said 1/3 of people, it just totally turns their life upside down. They're under stress, they have fear, and and those are the people that he said they're really trying to push this research for. So if there's somebody that's listening to this that has a severe case of Charles Bonnet and hallucinations are kind of getting the best of them or getting them down, what would you say to them?
Well, I'm glad you mentioned that. That was a very nice synopsis of that finding. People may initially be very alarmed by what they're seeing, but with some support and some education, they can be moved into one of those other thirds where they're there, but they're just as distracting or as inconvenient as my tinnitus is, but not something that interferes with my life. And of course, like you said, I have met a couple people who've seemed to like their hallucinations, and that's fine. Uh, but I guess the most important thing in my practice of psychology is for people to get where they feel comfortable and effective in their own lives, and moving them from where their lives are disrupted by Charles Bonnet's uh, hallucinations to where they can just acknowledge them and go on without any disruption. That's our goal.
Okay. And what would you say to a caregiver? Because a caregiver can be going through a lot. It can be very difficult. So, what would you say to a caregiver who's being a caregiver for someone with Charles Bonnet syndrome?
Maybe half of everybody I talk to that calls about Charles Bonnet are the caregiver. And at some point in the conversation, they may put the person that has Charles Bonnet on the phone, but it's usually the caregiver. Um, the baby boom generation would remember Twilight Zone. This is very Twilight Zone. It's totally bonkers. Why would this just sounds so divorced from reality that it must be the person's issue. Um, but remember, Judith Potts had an article called "Got Visual Impairment? Think Charles Bonnet." I'm sorry, got visual hallucinations? Think Charles Bonnet if they're visually impaired. So um, it requires support and education for the family members as well, and it can get to be very overwhelming where the person's saying, "Come in here, let me show you this thing. Come on, look at that. Can you see that? Look at that." And then they'll get in arguments about whether it's there or not, and that's a totally useless exercise. I think the most important thing is to make sure the person's safe, and that includes the caregivers. Everyone has a right to be safe. If the person with Charles Bonnet is uh, injuring others in their attempt to get rid of the hallucinations, then that has to be handled in some way. So there have been occasions when medications have been necessary in those situations. Listen to the person's emotions rather than what they tell you they're seeing. If they're very anxious, deal with the anxiety. Don't argue with them about what they're seeing. I hear you. I hear you're really upset about this. You're really anxious and upset. Here, come on in here. Let's have some coffee and we'll talk. We'll calm down a little bit. That's going to help more than anything.
Definitely offering the distraction, which
Absolutely.
was very difficult at times, but the more that my mother understood what she was going through, and with the help of cognitive behavioral therapy, actually, um, she and her counselor Scott worked through a lot of her emotions. Mom was 86 years old before she sought therapy, and that's a long time to push back feelings, and they will come up, and they will, I believe, I'm not a doctor, I'm not a medical professional, I make that disclaimer all the time, but from what I experienced and what I hear in support groups is that if you're dealing with a lot of emotional baggage and you haven't put it somewhere or dealt with it, it will exacerbate the hallucinations.
Yeah, and just just fear of telling people that you're visually impaired.
Hmm.
That's the first thing. If you think about grandma always wants you to take her to the bathroom. Now, is it because she's frail or is it because she can't find it? And can't find it because she can't see it, as opposed to is disoriented in terms of where she is in space. Everybody wants to be taken seriously, and I think this should be taken seriously.
I'm just thinking it's difficult enough to lose your vision, but then after a while or right away, depending on who you are, you develop Charles Bonnet, and it's like doubly um, disturbing, for lack of better words, to have to deal with it. I was thinking about what you said, Dr. Cusick. You said if somebody's a caregiver and their loved one has Charles Bonnet, they may continue going to them and saying, "Hey, look at this. Did you see that?" And that can be frustrating. But I was thinking that we, and I'm a caregiver too, have to be patient, because there was someone that was in one of your groups, and they said, one of the several of the things that you can do to help is to turn the lights on, turn them off, clap your hands, snap your fingers. And this particular person said, "How many times am I going to have to turn my light on and off and snap my fingers, particularly at night when you're trying to relax?" And I felt for that person, because I was thinking, me as the caregiver, I could get away from the person that has Charles Bonnet syndrome, whether it's going in another room, or if I live in another house, and I can get a good night's sleep. But that person with Charles Bonnet may not be able to get a good night's sleep, or their hallucinations may not go away. So they may have to try an alternative way to deal with it, where maybe wear face masks, or maybe just say, uh, no matter what happens, I'm choosing that I'm going to lay down right now, and I'm going to take it easy or get some rest. And that's easier said than done. That's why we always have people on this podcast that actually have Charles Bonnet, as well as experts like you, as well as caregivers, so we can get the full perspective, because we want this podcast to help everyone.
And blindness skills help a whole lot with Charles Bonnet images. You need to do what you would normally do in your home, regardless of what it looks like. Uh, using a white cane is very helpful in that. Uh, some people will stop because they think they see a brick wall in the hall and they can't go any further. But if they feel for it with their cane, they'll see it, learn that it's really not there. So a white cane could help a whole lot with this. Don't swing it around the room though, because you're hit one of your caregivers.
Yes. I've met that cane a couple of times when mom was uh, eliminating a hallucination. I wanted to ask Dr. Cusick, and I know more research is needed, and that's our goal. Would you think, or would you recommend, if somebody is dealing with a child who may be experiencing CBS, that their hallucinations could be much different than significantly different than those of someone with a, that's older, that has lived a longer life? So if you're, from what I've understood, in children it's imaginary friends, they do see some horrific images. And for a parent dealing with that, trying to be supportive, don't I would say, would you agree, don't put them down, don't negate, don't devalue them. That's the word I've been looking for. It with, you're imagining things, you tell your imaginary friend to go away, because a child isn't going to be looking at dementia. So I guess my question is, but beating around the mulberry bush, what advice would you give to a parent who feels that their child has Charles Bonnet syndrome?
Well, the first cut is, are they visually impaired? Um,
Correct.
I worked with many people who are blind from birth. None of them have Charles Bonnet, and will never have Charles Bonnet because they have no visual memory to improvise on. Uh, blind, blind brains are very different. For example, there's never been a case of a person born blind who had schizophrenia ever in the literature. So even a child needs to be validated, as you were saying, though. They're they're in a early stage in their development, and they need to feel that they have some personal effectiveness over their own life, and that they have some control even as a child. And you sort of take that away from them if you don't believe what they're saying, or just tell them to quit talking about that.
I think the thing we might be facing with the younger population, children of much younger age, and we at one time had heard that there was a 7-year old being treated in the UK. It's very interesting how their explanation of what they're seeing is going to definitely be different from an older person or a baby boomer. And do you think it would be a little more difficult to for that child not to be labeled with a mental illness? And it's so people doctors are so quick to give it another diagnosis without looking at Charles Bonnet as an option, a viable option of what might be going on with an individual.
Yeah, they could think that they're just incorrigible, or they're just can't be handled. So it's important to first and foremost take into consideration that the person has a visual impairment and they're seeing things. Now, what's going on there? It could be, as Shaman was saying earlier, it could be medications, legal or illegal. It can be a urinary tract infection. It could be growth in their brain. It could be a whole lots of things. So it's important to have that checked out by a medical professional. So you can't get away from physicians if you have Charles Bonnet. You really need them to eliminate anything else it might be.
So, process of elimination, just as with any other individual. If somebody's telling you that they're seeing something, again, I think it goes right back to Ken Ellis, who was on another podcast. Believe them. That's the first thing. And then go from there and advocate for them or yourself.
And you really need somebody who has experience with it. I've heard so many stories about Charles Bonnet. I can talk to you for a few minutes and tell you whether you have Charles Bonnet or don't. I had a optometrist call me one time, and he was telling me about what this woman was seeing and all that sort of thing, and put her on the phone. I talked to her for a little bit, and it was clear that it wasn't Charles Bonnet that she had. She had something else. She may be seeing things as a result of Charles Bonnet, but there were other things happening. She had some serious delusions, as opposed to just the little overvalued beliefs that sometimes people with Charles Bonnet will have. There's a distinction between those two things. Give you an example. Around the time there were anthrax scares and that sort of thing, I worked as an epidemiologist with the health department here in Louisville. And I was talking to a friend who was a veterinarian about being early sentinels, because dogs are down sniffing, and cats, they're lower into the ground and more likely to get some sort of contagion as a result. And his reaction was, I wouldn't know a case of anthrax from a case of Budweiser. So what he was saying there is he never sees it.
Right.
Most doctors will never see Charles Bonnet in their entire careers, or they may see one or two cases and not really realize what they are. I remember taking neuropsych classes as a postdoc and realizing that some of the people, institutionalized people I'd work with, had uh, a specific syndrome. It wasn't. I never really understood it, but it was a specific syndrome. So
And there's so much information on this.
right, and I hear people say Charles Bonnet syndrome, and your doctor these days are on their laptop the whole time they're working with you, and some will go to the internet and look it up. And I really think that's a wonderful thing that they're willing to say, geez, I don't know, let's take a look.
Mm-hmm.
uh, I can still think back over the 18 years I work with people with visual impairments and think, oh, they're seeing things, they're psychotic, but that probably wasn't what was going on.
Mm-hmm.
uh, it was probably Charles Bonnet, and I just didn't catch it because I wasn't conversant with it as yet.
Or informed, because as someone who has worked, you and I both have worked in the assisted living facility industry, and I can look back now and realize, yeah, so many of these individuals that I worked with, this is what we were looking at, but we were treating them for something completely different, which is why it's so important for it to get out. And I want to thank you, Dr. Cusick. There's so much information. We're going to have you back on, because we haven't even scratched the surface of the things that you and Shaman and many of the other individuals in our support group and in our community have talked about. And I see our community growing substantially as the word gets out, please don't hesitate to call us if you want to talk about this. And Dr. Cusick is so open. If we don't answer, we will call you back, leave a message.
Leave a
I'm
message.
going to turn it back. Pardon, sir?
Leave a message, please.
Yes. And I'm going to turn this back over to Shaman. Dr. Cusick, thank you so much. You are the inspiration for the nonprofit being launched very soon. And thank you for taking care of my mother and helping her regain her mental health and her value as a person, because you let her know that she wasn't crazy and that it was Charles Bonnet. And then we were able to start helping her. And unfortunately, we just weren't able to keep her long enough for her to grow with it and incorporate it into her life. But I can tell you, she was very fortunate to find you. She felt that way, and she took a big deep breath after she spoke with you and finally went to sleep and got a good night's rest. Thank you for that.
Oh, yeah, I'm so happy to have. I retired 2 years ago, and I'm so happy to have this as a way of continuing to use my education and experience.
Wow, we really appreciate that. And all of the information that we spoke about, we're going to leave in the show notes as far as emails and phone numbers. And we are also going to put information in the show notes about how to join Dr. Gary Cusick's weekly support group for people with Charles Bonnet Syndrome and their families, and then for caregivers that immediately follows that. Dr. Gary Cusick's phone number is 502-439-0398. Once again, that's 502-439-0398. And his email address is garymcusick at iCloud. That's GARYMCUSICK at iCloud, ICLOUD.com. So we are going to wrap this episode up. It was great as always. And we'll see you guys on the next episode. Thanks for spending this time with us today.